I think that now we can continue with ideas like memory, dreams, etc. So I would like to ask Dr. Ajay to say something about memory, how old age affecting memory, or some other reason, because of some other reason, memory being affected. So something about memory loss. Actually, I had a problem with memory, but right now I'm quite okay with it. But some 3 years back, when I was delivering a lecture, I had this problem getting suddenly stuck up with something. I had the problem again. Then 1 week back, a friend of mine was here. He had made the decision to become a Buddha Bhikshu, and he was talking about it. And he was here with me for 5 hours. And then whenever I was talking, I had this problem of forgetting what I had said, the very, just the minute before what I said something, Now it is quite okay. So I would like you to say something about, the manner in which, memory gets affected, due to age and similar things. Anything about memory from your experience of, having practiced as a psychoanalytic psychiatrist.
See, what to me, what is fascinating about memory is not necessarily the neurological or the biological aspects of it, but more so how emotions and our psychology affect memory. So when you ask about memory loss in terms of old age, largely we're going into territory of dementia, which is largely a neurological problem. So there are particular problems in the brain functioning, which is why you get these gaps in memory. Largely it is memory being laid down that is affected rather than lost, but gradually as dementia progresses, you get both difficulties. But to me, what is fascinating is the number of things that we keep forgetting in our day-to-day life, from our childhood, from our development. You mentioned what happened. You met somebody recently, and there seems to be a gap in your memory about it. When we take a psychoanalytic history, what we also keep our mind open to is what is left out. Because what is left out, the gaps, are much more important and fascinating than what is remembered. Because what is remembered is processed through our conscious thinking apparatus. So it is, in a way, it is like processed food. So it has been modified, it has been refined, it has been cleaned up. So it has been made acceptable to both me and what I think is acceptable to you. Whereas the gaps often tell us what are the difficult areas. What are the areas where this person has some problem with, or it doesn't sit right with them. And that can give rise to interesting conversations about, for example, a person might give me a history about their whole life. For example, recently, this was last week, I met a patient who gave me a very good history. So she had come to this country from one of the Southeast Asian countries. She came here in 2014, did a university course, a professional course, and then started working. and she developed some problems. So she is one of the healthcare profession. So she's a psychologist, and then she started having problems with one of her patients and their family. So I asked her, tell me a little bit about yourself. And the whole story started from 2014, which is fairly recent. And I was wondering, for this person, the history starts just 6 years ago. How can that be? And what had emerged was that this person had a very traumatic memory of childhood, of which they had tried to blank out a large section of it. And this meeting with this particular family, whom she was supporting, had reactivated a lot of that traumatic memory. So the patient was a child in the family, not actually a child. It was a person with a learning disability, an intellectual disability, who had a mother who was extremely critical, who would be nice to my patient, the psychologist, as long as she did what the mother wanted her to do for the patient. As soon as she started using her own mind, using her own thinking or initiative, and doing things her way, the mother would become very critical, very difficult to deal with. And going back into her history, it took a little bit of uncovering, was that the same thing was what had happened with her mother. So her mother was an extremely critical, difficult woman. She was a professor of something in a university back in her home country, a high-achieving person who not only managed her professional life, but home as well, but was extremely critical and harsh, a very harsh disciplinarian towards my patient. And that had been sort of subsumed or kept aside, not kept away from her awareness. Because to her, the conflict was with this parent of her patient who had the learning difficulty. So that was the problem of the day. And the other issue, which was much more sensitive to her. So it is easier to pick a fight with somebody that one has nothing much to do. The patient, you can see them. If they are not happy with you, you can say, okay, I'll pass you on to one of my colleagues. Whereas you can't really do that with your own mother. You can't change your mother. You have the mother that you have. And what to do with the memory like that, which is being reactivated by this fresh trauma. So often what we find is, and this is one of Freud's quotes, that whenever we see another person, what we are actually seeing is something that we already have in our subconscious. There is never a fresh view. Mm-hmm. So when I met you for the first time, yes, I did meet you for the first time, but actually I'm just fitting you into some template that I have for somebody. So memory is very interesting in that we think of memory as what we remember and what we can tell other people. But more fascinating and more important to our day-to-day functioning is how we are so controlled by the stuff that we don't really know that is there.
Mm-hmm. The Interpretation of Dreams by Freud was published, I think, in the year 1900 or so. So since we were talking about memory, I wish that you could, talk about, dreams and what, I do not want to use the word patient, but people with problems regarding, their mind. How do things surface through dreams? I don't know whether you in your practice, you come across such things when you meet your patients.
Dreams are a very important part of, are an important part of psychoanalytic work. They are it doesn't take, for example, in my own analysis, there are some important dreams that do come up, but in terms of the public perception, most of the work is not necessarily about dreams. Most of the work is about what happens in day-to-day life. I got angry with this person, I was upset with that person, or I like this person, whatever. So all of these day-to-day mundane things are what are talked about. In between, one could get, well, I would use the term patients for the people that I treat. Patients will bring up material from dreams. For example, one of the patients that I'm seeing, who, due to problems with various problems that happened in his life with addiction and other issues, suffered a huge loss. And it was quite shameful for him. And the dream that he saw was of him having fallen into the gutter. Important people in his life standing around him and looking at him. And so in the dream, what is important is that there is what is called primary process thinking. What basically it denotes is that a dream is a particular phenomena where normal logic does not apply. Okay. Logic of temporal progression, that is time, person, nothing applies. So it is a fantasy world where I can have a conversation with myself either 20 years from the past and, if necessary, 20 years in the future at the same time. So there can be three of me. There can be three of me with multiple other people. So the kind of things that we usually associate with logic does not necessarily need to be there. So if we just look at this particular dream that I talked about, where this person was in the gutter and there were people looking at him, there are two aspects. There could be him in the gutter experiencing other people looking at him and making fun of him or saying what a shameful thing has happened to you. At the same time, he could be the person looking down at himself also. He could be the person having an attitude of, he was like berating the person who has fallen down, which is also him. So he could be both the attacker and the victim. He could also be somebody in the crowd who's helping him up. Okay, so interpretation requires one to be aware of what is happening at that moment for this particular person. So a particular dream can be interpreted in different ways, but at that particular moment, there may be one particular interpretation which is more right.
The context is also important in that sense.
Context, absolutely, exactly. So that is what I'm saying. So there is no sort of standard interpretation for any dream. It all depends on what is happening in that person's life, or in that particular session, what was happening just before he related.
Right.
It all depends on the context. So you're absolutely right. It depends on what has happened just before, what was happening in the session, what are the associations the person makes just after, and depending on that, you might be able to get the right interpretation, which will then click with the patient and it will make sense. It is not that other interpretations are not possible or not right. It is that each moment, one is probably a little bit more right than other interpretations. And that is what generally we look for in psychoanalytic work, which is what is the aspect that is most bothersome to the patient. What requires to be made conscious at that particular time. There may be many, many different things that are in the unconscious. Bringing that out would not be very helpful to the patient, would not be useful to the patient. So when we make an interpretation, we also need to think about what can this person use at this particular moment in time. out of all the different interpretations that are possible, which one is the person going to be able to use? Okay. Often, as the therapist, you are not necessarily able to have this breadth of view. You are often in a position where you're being forced to say something or you're pushed into a corner. So things happen. At these points, if you are able to keep what is said to be the third position, the third position is very important in psychoanalytic work, which is, see, now we have yourself and Ashish is also there with us. Okay. So Ashish is sort of like a third person who's looking at us. So when a patient and I am in the therapy room, there needs to be a separate part of me that is looking at the two of us having this conversation as well. And that person is the one that will be able to have maybe a third point of view and might be able to detect certain movements that are happening between the two of us.
Now, I think I will conclude with a general sort of question. We are now in the 21st century. And what do you think about the general condition as such now in the world, or maybe in Australia, or maybe in some other places, when it comes to the general mental health of human beings? This transition from the 20th century to 21st century with all these new things, all these new gadgets, where are we heading to? To a better awareness of these things and then being able to manage things in a better way? Or
see, I think we touched on the issue of
computer. We discussed that
the last time as well.
Right.
See, I'll pick that question apart and make it into two. One is about where technology is heading, but also I'd like to make a comment on where generally humanity is heading as well. Generally, the tendency that I find is for people to say, and it depends on what kind of person you go to. Well, at least in India and elsewhere, I have found people who have a longing for a glorious past.
Mm-hmm.
A past that was full of fantastic things, a lost glory, everything was so. This happens in day-to-day life as well. So when we talk to students, we will say, oh, in our time we learned so much, we did this, that, and we have, nowadays teaching is very bad. Right. But who's responsible for that? I'm the teacher. I'm responsible. That I don't look into. But I say, oh, things are much more easier for you. We had it so difficult. We went through a lot of hardship and things. And each generation will have that view about the previous and the forthcoming generation. I think one needs to take a step back and look at what we are talking about. So if we look at certain glorified aspects of history, yes, they may sound nice, but then we are missing out a large chunk of what humanity went through. So if you look at the number of people dying due to diseases, wars, and all of those things, nowadays we think that probably the world is more violent now, but that is not at all the case. The world was much, much more dangerous, violent place where people died in their 30s and 40s. A person living up to 50s and 60s was a big thing about 100, 200 years ago. And these kind of views are also, I think we touched upon this again the last time, it's a kind of black and white thinking where we try to sort of, when we want to glorify something from the past, we completely negate all the shades of gray and just look at the good things that happened and we think of it like that. I think there is, in general, humanity is heading into a better future. We are much more thoughtful about what we are doing to the environment, to ourselves. We are much more thoughtful about how we behave with each other. There is at least a language to express problems and to discuss these things. Us having this discussion across 2 continents is an example of that. So this is being recorded. Somewhere it is going to be available to maybe whatever number of people, 5 or 50 people who or 500 people who see it. So there is, for good or bad, this is a viewpoint, a discussion that is going to be available. So there are multiple discussions like this that happen, and that is also where technology comes in. One of the unfortunate ways that technology is being used, which we are again finding out more about, is that technology that is designed to inflame the emotions is going to cause problems. So that is what we saw in Cambridge Analytica with the Facebook, how they have been able to influence elections and people's views in subconscious ways. So that is the thing. So all the work is done subconsciously without actually telling you what it is that they're doing. So so for example, for gun control, they were able to...
what control? I didn't get that word.
Gun control in the US. So in the US, right, gun control is a big issue. So depending on the particular person's interests, they were able to classify people into various categories. So if I am somebody who reads the Indian Express or the Hindu or the Times of India or whatever other paper, what are the kind of articles that I am interested in? Yes. What are the kind of areas that I'm interested in? And they are able to typecast me into certain things. And they are able to find the same message can be made palatable to me as well.
Yes.
And that way they have been able to influence people who would otherwise not have been influenced. And this is a very highly specialized skill that artificial intelligence, once you put the algorithms into place, they start learning about these things and then can just go ahead and create havoc. And we've seen manifestations of that not just in the US or Europe, a lot of countries in Europe, and to a certain extent, I think it was happening in India as well, because a lot of Indian political parties were also paying money to Cambridge Analytica for help.
Yes.
So the ways in which we have been influenced, because it was not known, is much more powerful. The moment it is clarified, so when we see an advertisement for anything outside, we know that it is an advertisement.
Yes.
Okay. So if we see, what is that ad? Asking a young woman, which college are you studying in?
Yes.
So, and then the child comes.
Yes.
So we know that we can understand that and we can laugh at it. Right. And we know that it is an advertisement. We are not being cheated into believing that this can actually be. Okay? So it doesn't matter much, because clearly they are saying, you go and use this soap, you will become like that. So we take it, we know that they are trying to promote something that doesn't. But when that same thing is done without that clear communication that this is what we are trying to do to you, that is when it becomes much more dangerous. That is when
the subtle manner in which things are controlled.
So advertisement, when it is hidden, is much more powerful. And advertisement has been hidden also. So their product placement is something that happens a lot in various medias, where it is not explicitly stated that this is what is happening.
Right.
So it is like in a doctor's thing. So various drug companies will come and fill my room with various things. My rooms will not have that, but you know what I mean.
Right.
It is, and that has a subliminal effect on both patients and myself. So we are all much more susceptible to these kind of things than we think. So anyway, going back, so I think overall humanity is, I think, going into a better place because we are able to look at these things. Yes, there may be a few moments when we have faltered, we have been affected by these things, but then the conversation starts again. We are able to talk about these things, point out what is happening, and then the discussion proceeds. So we will always, and that is the whole process of learning, adjusting, adapting, and then moving forward.
Right.
So there will be disruptions that happen. We probably will not know how to deal with these new technologies or new things. Eventually, we will, I think, as a group, we will work out how best to go forward.
Right.
And the same with devices and other things as well. So artificial intelligence will definitely be a hugely disrupting force. But we will, I think, get there in the end, be able to harness it. Well, that is hopefully. Otherwise, it could be there are lots of people who say that is going to be the end of humanity as well. It is better to believe in a better future than the other way around.
Is it fine to talk a bit about Tara and the concepts?
Tara Clinic.
Yeah.
The clinic that we established in India is largely now in the virtual world. We are. I'm not able to do clinical work in India. My clinical work is in Australia, largely or completely in Australia. I do some support work for. We support. I think I was talking about them last time. There's a girls' home that we continue to support in India. My wife is also, as she's also in the field, and we continue to do a lot of teaching and training for psychologists. So that is largely the legacy of Tara Clinic that we have.
Right.
We are in the process of establishing something here, but that will take some time to come to fruition. We are in the early steps of that. But it is an area which we're both passionate about, and its applications lie across all walks of life.
Right.
We are largely into helping patients with this particular skill or knowledge, but there are lots of people who use it to interpret art and literature, which I know you wanted to talk more about, but my area of specialty is,
you said that, right.
Yeah, I do read, but that is...
what do you read right now? Do you read literature now? Apart from books related to psychology and psychiatry?
I have to keep reading psychiatric books. The moment I stop reading, I will stop being a psychiatrist. So there is a lifelong need to keep up. But I also try and read other things as well. I try and keep up with literature, both modern and... I'm rereading Asimov's Foundation series now. So I like science fiction is a big favorite of mine. The Dune, the movie has come out. So
you were referring to Asimov.
Yes, Asimov's Foundation is what I'm reading at the moment. But before that, there was a Dune movie which has come out. I'm not sure if it has come out in India, but Dune is one of my...
Which one?
Dune by Frank Herbert.
Right.
It is... It is of all the science fiction genre, I think he's one of the best. Yes, I'm eclectic. I like to read a lot of. There is Gore Vidal's Creation. Yes,
Gore Vidal, I know to a certain extent.
The Creation is one of the books that I like a lot. Amartya Sen is another favorite of mine. Naipaul is also. Naipaul is somebody that, and from my background, what I find is, and I particularly like his non-fiction. Non-fiction, where he's done his travelogues in India and other places. There is a directness about him, which I find quite fascinating, because it is completely unprocessed in a way. What he feels, he will just throw it out there.
Right.
Whether you like it, whether you don't like it, that is, it is not of his concern. Now, one could see that as an arrogance, and I'm sure there is an element of that, but being able to be so sure of what it is that is going on within you and being able to articulate that, I think is a skill.
Yes.
And he's doing that in the context of a book that he's writing. We have a choice whether to read it or not read it, and like it or not like it. And another person who has tried and has come close is Maximum City in
Yes, I forgot the name of the writer.
Siddhartha Mukherjee.
That's on Bombay. I think that particular book is on Bombay. I forgot the name of the writer.
Siddhartha Mukherjee, is it? Or I'm not sure. But there also, he goes and interviews people and has these very fascinating conversations with people, which just brings alive what is happening at that place and at that time. And that is the same thing that Naipaul does. When he goes to various towns, he meets with people there. And it is through those conversations that we get to know about that.
Yes, right.
And that I really, and it is an area of work that is my day-to-day life. I sit with people, I listen to their stories.
Yes, right. Listening to people's stories in one sense.
Absolutely.
And also interpreting them, you know.
And yes, where they
putting all those stories in certain contexts.
Where they want me to. So a lot of it is me listening, and in certain places they will invite me to make comments or make some interpretations, which I can make. But yes, so yes, it is without fiction, without reading fiction. That is an important part of. It should be an important part of everybody's life.
Yes,
fiction in terms of reading or stories being told. And I think that is what civilization is all about. It is about being able to tell somebody else a story.
So thank you very well. You know, we will meet again. You know.
My pleasure. Thank you very much.
So hopefully the listeners will also find it interesting, and we'll come across different topics in psychiatry, and I think we'll discuss more. Thank you so much.
I'm sure you. My pleasure talking to you. Thank you. Bye.
See you.